Okay, so before I go into the room for urinary catheterization, I'm gonna make sure I have a doctor's order for it, and then I'll also make sure that I have all my supplies with me. So, a 10 milliliter syringe, a stat lock, the catheterization kit, clean gloves, hand sanitizer, a chuck, a towel, a basin with warm soapy water, and I think that's pretty much it. Okay, so I'm just gonna knock knock. Hi, I'm Helen. I'll be your student nurse for the day. How are you feeling? Good. You're not feeling like there's no discomfort, no pain or anything. That's good. Okay, so I heard you're having trouble urinating. Yeah, okay. So there has been a doctor's order for me to put in a urinary catheterization insertion. And so I'll just be doing that for right now, okay? Okay, and have you ever had this procedure done? You have? Okay, let me just refresh your memory real quick. So I'll clean your perineal area and then I'll insert the catheter and it'll drain your urine, okay? And you are able to move around, and then once your doctor puts in an order to move it, I'll come back to remove it. Okay, so before we get started, I'm going to ask you for your full name and your date of birth. Okay, Jane Doe, December 12th, 1996, perfect. And any allergies, especially to like shellfish, especially because we're going to be using iodine to clean you up today? No? Okay. So first, before we get started, I just need to prepare my supplies and my table, and then let's get going. Okay. So first thing I'm going to do is I am going to close the curtains for privacy, and then I will sanitize. And I'm going to clean the tables. I'm going to wipe for 30 seconds. Making sure I get every single corner and try this. Okay, and then I'll let that dry for 2 minutes, and I'm also going to do this one as well, because there's not enough space on that one. 30 seconds, and then 2 minutes, and then let it dry. 2 minutes, and throw it all away. Then sanitize, and then I'm going to bring all my supplies over. So my kit there. Can put clean gloves here. My chuck, my basin of cool, warm soapy water, stat lock, and the 10 milliliter syringe, and then towel. Okay, so then I'm just gonna sanitize. Okay, Miss Doe, so first thing we're gonna do is that we're going to clean your perineal area with warm soapy water, okay? So I'm gonna take the blanket off of you real quick, and then just let me know if it's too cold or too hot, okay? So let me just put you prepped. So you're in supine position right now, and then I'm also just going to sanitize, grab a pair of clean gloves. And I'm just going to move your legs, externally rotate them. Perfect, this side as well. Okay, and then I'm just going to put a chuck down just so the bed doesn't get wet while I'm cleaning. So lift up, okay, perfect. So then everything is prepped and ready. So then let me just switch out these gloves. And then sanitize. Put on new clean gloves. Okay, and then here's my basin with warm soapy water, and then my towel. So we're just gonna dip it in. Okay, so first thing we're gonna do is we're just gonna go from inside out. So I'm gonna go the inside, front to back swipe, okay? And then inside, front to back swipe. Okay, and then outside, front to back swipe. And then another outside, front to back swipe. And I'm just gonna get this card and I'm gonna go swipe down the middle, okay? So then it's all dry now. So I'm just going to clean all this up, put it away, clean this up. Okay, so then I'll just take off my gloves now. Sanitize. Okay. So then I'm just going to open up the kit. And throw this one away. I'm going to open it up this. Like that. So the sterile drape, I'm just going to grab by the edge, and I'm just going to leave it right on the corner there. And then sterile gloves, so I'll just put it right here. And then this one we will not need, so I'm going to throw it away. And then the sterile 10 milliliter syringe for the urine. Right there, throw this away. And then the stat lock, throw this away. And then I'm just going to grab the sterile drape now. And I'm going to grab it by the edges only, and then shiny side down. Whoop. That. Okay. So then now I'm going to go back, I'm going to hand sanitize, open up my sterile gloves. Okay. Okay. Okay, and then I'm going to throw this away. And then next thing I'm going to do is I'm going to put this to the side. The urine, the 10 milliliter syringe to the side. The cup also to the side, just slightly having on top. Here, so it's fall. And the next thing I'm going to do is I'm just going to move this over. Okay, and then first thing is I'm going to attach the sterile water to the balloon port. Actually. Okay. And then take the plastic off of the catheter, and then get the loop. Throw this away, and then we'll get the tip of the catheter, and we'll put it in here, and then we'll just leave it there for right now. Okay, and then next thing we're going to do is I'm going to get the iodine solution, the antiseptic iodine. And then we're just going to soak it. Throw this away. Okay, and then we're going to put this here. And then I guess we'll bring the whole thing over. Okay. So now we're just going to start with your cleaning again. So this time we're going to go in with iodine soaked cotton balls. And so we're just going to get started. So I'm just going to hold it. And we're going to go outside in for this one. So wipe the outside, pull away, and then I'm going to drop it into the trash. Wipe the outside, pull away, and then drop it into the trash. Wipe the inside, pull away, and then I'm going to drop it into the trash. Okay, and then the other inside, pull away and around, and then drop it into the trash. Now we're going to go in the middle. Okay. Now we're just going to throw this away. And then it's time to insert the catheter, okay? And so the first thing that I'm going to ask you to do is take a deep breath, okay? And if you ever feel like pain that you can't bear, just let me know, okay? Okay, so first, I'm going to grab the catheter tip 2 inches from the tip, and then I'll insert it when she blows out of her deep breath. So take deep breath. Okay. I see urine, so I'm going to go 2 inches more. Okay. So I'm just going to keep it holding there, and then I'm going to squeeze, inflate the balloon, and then I'm just going to take it off. It can be right there. I'm going to gently tug. Okay, it wasn't too bad. Okay, so there's no pain when you had that. Okay, so then now we're just going to need to have a urine sample taken from you just in case, just to make sure there's nothing too serious happening. I'm going to throw this out to drop it right there. And so I'm going to get alcohol wipe now. Wipe it, let it air dry. And then I'm going to get the urine syringe sample. Twist it on. I'm going to kink it right below the port just so we don't get any urine from here. And I'm going to pull at least 5 milliliters out. Okay, so then we're done with that. I'm going to leave that right here. And then we're going to put a stat lock on just so it just stabilizes and it stays in place. And then let me just hold on. Okay, and so I'm going to tape it to the upper thigh, and I'm going to make sure there's enough tubing so you can pull on it and it doesn't like leave out. So it's attached to the upper thigh, and then I'm going to bring this back down here, and I'm going to hang it onto the bed so that it is below the bladder. Okay, and then I'm just going to bring this up, put this away. I'm going to reposition your legs. Reposition, put a blanket right back on you. I'm just going to take these gloves off. And then just sanitize. Put new gloves on. Okay, and I'm going to grab this, open it up. I'm going to squirt the urine in. I'm going to go pretty slow just to make sure that doesn't splash everywhere. Okay, throw this away. Actually. And then I'm going to label it with patient name, date, time, and then the MRN, so medical record number. Now I'm going to send this to the lab. So I'm going to clean this up real quick. Take this off. Sanitize. Okay, so we finished with our procedure. How are you feeling? Good? No discomfort, no pain? Okay, that's good. If you need anything else right now? No? If you need anything else, press the call button. I'll be here as soon as possible, alright? Okay, bye. See you later. Okay, and then I'm going to sanitize again, and then leave the room. And I'm going to document on the patient's chart, so date, time, how the patient tolerated the insertion, so the procedure. She did pretty well. She had no pain with it and no discomfort after. And then the size of the catheter we used, so we used a 14 French. And then the urine description, so it was clear, it was straw, there was no odor. When I left, the bag already had about 30 milliliters in there, and then I put in about 10 milliliters of sterile water into the balloon to inflate it. Okay, so before we start this procedure of removing the catheter, I'm making sure that I have a doctor's order for it and that I have all my supplies, so a truck, 10 milliliter syringe, and clean gloves. Okay, so knock, knock, knock. Hi, Miss Joe. So, how are you feeling today? Good? Good. So I just received an order from your doctor that today is the day to remove your catheter. Yay! Yeah, so it'll give you a chance to use the bathroom on your own and see how it goes, okay? Okay, so before we start, I need to know your full name and your date of birth. Jane Doe, December 12th, 1996. Perfect. Do you have any allergies? No? Okay. So first, before we start, I'm just going to get everything prepped and then we'll get started, okay? Okay, so the first thing I'm going to do is I'm going to close the curtains for privacy. And then I will sanitize. And then I will put on gloves. Okay. I'm going to undrape her, take the blanket off of her. Alright, I'm going to make sure you're in supine position, and then I'm going to externally rotate your legs, just so that there is some area in the middle here. Perfect, and then I'm going to put a chuck down. Okay. Okay, and then I'm going to get some type of alcohol or water to remove the stickiness, so it's off, and I'm just going to take this off just where it doesn't weigh it down or anything. Throw it away. Take these gloves off. And then I'm going to hand sanitize, and then I will put these ones on. Okay. Alright, so first I am going to get my 10 milliliter syringe, sterile syringe, get that. I'm going to attach it to the balloon port, and I'm going to take out about 10 milliliters. We want 10 because on the chart it was charted that 10 was put in, and we want the same amount taken out so it is fully depleted. So not exactly 10, so I'll just go in again and redo it. Put some more. Okay, perfect. Okay, now I'm going to discard this. So I am now going to remove it, okay? And I want you to take a deep breath. And when I remove it, I'm going to ask her to take a deep breath, and then I'll remove it once you blow it out. Okay? Deep breath. Okay. That wasn't too bad, right? No, it really wasn't. Okay. So I'm just going to go quickly to the bathroom to measure this and discard it, okay? So I'm going to the restroom, and I'm checking, and it is about 300 milliliters in here, and so I will remember that to document later. I'm going to discard this. Come back into the room, take off my gloves, clean my hands. Okay, and then I'm going to reposition your legs, and your blanket is on you right now, okay? So that wasn't too bad, right? Removing? No, okay. And so when you do have to go pee or void the next time, just press the call button, and then I'll be here because I just want to make sure that your bladder is working properly and that you're fully emptying your bladder. So I want to measure it, how much you void. So in the toilet there is a hat that will catch your urine, and I can look at it and measure it. And if there's any problems while you're voiding, just let me know. And some stinging and some burning may be possible in the first couple of voids, but it'll go away and lessen over time. And if you haven't urinated or called me in 6 hours, I will bring a bladder scanner over here just to check your bladder, okay? Any more questions for me? No? Okay, so I'm going to leave you and hope you have a nice rest of the day, okay? Okay, so I'm going to leave the room and I will sanitize. And I will document the date and time, how my patient tolerated the removal of the catheter, and she did pretty well. There was no resistance, there was no pain. The urine that was in the bag, it was clear straw, 300 milliliters, and then when I deflated the balloon, it was there's 10 milliliters out, so the same amount in and same amount out. And so the next two voids, I will also document these same characteristics as well.